Getting into a conversation around breast cancer awareness, and joining us for that this morning is Dr. Catherine Nyongesa, who is an oncologist, and she'll tell us again what an oncologist is. Good morning, Daktari.
Thank you so much for having me.
Karibu sana, we're thanking you so much for being here. David Makumi is the CEO of Faraja Cancer Support Trust. He's also joining us this morning. Good morning, David.
Good morning, and thank you for having me here.
Well, thank you both of you for being here. We're talking about something that is a big deal. Sometimes cancer has almost become a buzzword. Like, okay, somebody's sick, they're terminally ill, they're dying from cancer. But we don't realize that there's a lot that we can do to prevent this and or deal with it when it's in its early stages. But that's why both of you are here, to then be able to tell us what we do. But before that, Dennis wants to share today's proverb. We'd love to hear from you.
So our proverb today comes from the country Sao Tome and Principe, right? So it's an island country located in the Gulf of Guinea off the west coast of Central Africa, near Equatorial Guinea and Gabon. It's also a country whose population is around 247,000 people. And if you are a lover of chocolates, perhaps you've just had a piece of Sao Tome and Principe, because they grow a lot of cocoa. But we go to the proverb today. The big fish eats the small fish. Daktari, how would you go? Ladies go first. How would you interpret that?
Okay. Thank you for that proverb. I think it has a lot of meanings. It depends on how you look at it. For me, for example, cancer is a big thing, and it eats small as humans. And then also from the Bible, they say that those who have more will get more, and those who have less will get less. Thank you.
Yeah. How would you interpret it?
Yeah, big fish eating small fish. Well, as a Kenyan,
All right.
I didn't say nothing, but you just find, we are in a situation where the rich are getting richer and driving much bigger and bigger cars, and the people, the less privileged, underserved, struggling down there. When you think of it, there are many ways of looking at that, because then the small fish, which is maybe the vast majority of us, the hula poi, we do just so much, and these guys are riding on our sweat, blood, and tears.
When you just started, as a Kenyan, we already understood.
I should have said fellow Kenyans.
We would have known definitely.
We would have known exactly what you meant, Yeah.
It is another proverb.
Yeah, it's
another proverb. Yeah.
Fellow Kenyans, you know exactly what's up. Yeah, well interpreted.
Indeed. So we're looking at breast cancer this morning. The number one cancer killer in women in the country, and not just held to women, but also men suffer from breast cancer, but the women, of course, in the majority. So let's start to look at this a little bit. We've looked at it year after year, and ever since, unfortunately, cancer made its debut in Kenya. So we're looking at the most common and the number one cancer killer for women in Kenya, and in most parts of the world as well. Daktari, let's start with you. It is the most it's the most prevalent one. What are we looking at when we're talking about breast cancer, and exactly how it manifests in the body?
Breast cancer is a tumor or a growth, which is malignant, which means it can spread to other parts of the body. It arises from the breast tissue, and the breast has got different types of tissues. It has tubes in it, it has fat, it has muscle. So it can start, most of the time, starts from those tubes inside the breast, like the ones which, when a baby is breastfeeding, bringing milk, so it flows through some tubes. And now, once the cells undergo some genetic change or DNA changes, they start multiplying abnormally. And with this, it will form a growth, and this growth can spread. Looking at our statistics, it's the most common cancer among women. In fact, if you take 100 people with breast cancer, one of them is a man. So 1% in men, 99% in women. And we say that the commonest type is called ductal carcinoma, but we have other types like lobular carcinoma. All these are just when the doctor looks under the microscope. And not one breast cancer type is the same. It varies from person to person, and the patient will need more attention to identify exactly which type of breast cancer one is suffering from.
Oh, that's interesting. So if two women were to come in, these, and you know how you can say, well, you know, I broke a leg in this same place and somebody could have broken a leg in this same place. No two women would have the same kind of cancer?
Yes, it can vary. One, there are very many things we look at. The age. We also look at the molecular composition of that tumor. We have what we call triple negative. We have hormonal receptor positive, triple positive. So what does it mean? When we go to analyze that tissue in the lab, there are some red flags that appear on that breast, that breast tissue. And those markers are actually now being used in the modern medicine for that targeting treatment. So you cannot have the same type at the same time, but we have as the most common types, which include the hormone receptor positive. This is followed by the triple negative. And also on top of that, we have the triple positive. So they are all type different. And then we look at your age. You could be premenopausal. Another one will be perimenopausal. And another one is postmenopausal. That is, are you still having your periods or have you gone into menopause? So the behavior is it differs among all those groups.
Okay. I think about this, and I read an article a couple of days ago, actually, about the ages of folks who are getting breast cancer, actually lowering now in age. So, David, is that what we see? Coming into the center, are we seeing younger people with cancer than we saw before?
Yes. We see a lot of young women and largely, younger people with different kinds of cancers. And coming to breast cancer specifically, you see a lot of much younger women in their 30s and women who are premenopausal, who have not even gone into menopause. So these are professional women in their 30s, in their 40s, in these parts of the world. Breast cancer is really a disease of much younger women compared to women in the Western part, in the West, in Europe or North America. So we run support groups, and most of those women who come there are people who are professionals who are still working, or others who are even in college. Yes, with the disease of much younger women in these parts of the world.
I mean, Dr. Let's look at cancer in the country, breast cancer to be specific, and we look at a situation where, because I have a friend who says she just felt a lump, went to hospital, found it was benign, and never thought of looking for second opinion. And a few months later, she needed to now go through proper treatment. I mean, just in terms of health-seeking behavior that we see today, what are we experiencing? What are we seeing in our hospitals? Are more Kenyans coming out for regular checkups to just know their health status? Or is it a point of, I'm in pain, then I need to go to hospital?
Yeah, that's a very important question. We see the health-seeking behavior is still very poor among our population, and we appreciate efforts like what you are doing on SpiceFM just to create more awareness. So we are getting more awareness on the ground, but people proactively coming to hospital is another story. What we are now focusing on is for people to know the normal. Get to know your normal breast. I think that is good enough. And then if you notice any unusual changes, please seek help. Unfortunately, most of the cancers, when they are early, they are painless. And most Kenyans will go to hospital if it is paining or you have a wound. It's just, that is how it is. Unfortunately, when the tumor is paining or there's a wound, it is a sign of advanced cancer. Also, the fear. Fear is real. You always think this thing will go away. Cancer does not go away. You need to seek help so that it's treated early. In fact, the earlier the treatment, the higher the cure rates, more than 90%. So it's always good if you see any changes, go for assistance, see a doctor. The good thing is that over 80% of the lumps we feel in our breast are not cancerous. They are benign. So be rest assured, only a small percentage will be cancerous. And if it's discovered to be cancerous, there is hope.
Okay. So we heard it from many years ago, and they would say, and it would sound almost vulgar, but now we get it. Touch your breast. All the time, and not to go crazy or anything, but there's a reason behind that. Because if you did it regularly, then you would know if there was something that was irregular.
Correct.
Are we still in that place where we say do it regularly?
Yes.
And because you will know if there is something that is off, David.
The emphasis actually is on breast health. When you are checking your breasts and getting to know first how they look like, so that the day you'll see an abnormal change in color of the skin, you say, I know my breast and this is a new lesion or something. So you know how they look like, and you also know how they feel like. So that once you get so used to that, the day you'll touch your breasts and feel something unusual, you'll say, this hasn't been there. This is new. I need to not just know it is there, but I need to take a step to go and get it checked. So when you are checking your breast, you're not like looking for breast cancer. You are getting familiar with your breast. You are taking charge of your breast health. As Dr. has said, 80% of what you will find is not cancer. It could be many other breast diseases. So all breast diseases are not cancer. So when we encourage people to do that and talk about it, as you said, maybe 20, 30 years ago, people would not talk about breasts. Maybe not even on air, on radio, mentioning breasts.
In fact, we give them another name.
You not talk about breast in a church or in a mosque. But now we need to talk about this in every public space. Breast health. So what is normal for me? What is a lesion? And not just the breast. If you're examining your breast, you also need to check, the armpits. Because you may have glands that are swollen, and you need to get those checked, because breast cancer may spread to the lymph nodes over there. But you could also have lymph nodes for other reasons. So it's very, very important, and that also goes for men and women alike, because men also do get breast cancer. They won't talk about it, but it is important. If a man also notices changes that haven't been there, you also need to go and seek help. Talk about it. Iko shida hapo.
Let's twende pole pole. Please talk to me as a man.
Yes.
Because you see, most of the time for men is really never even get to think about it. It is part of your body, but it is not something that comes to your mind that you need to check. I'm inside the shower, I've done my thing, I'm out, scrubbed myself. If I'm applying my jelly, I'm out, I'm gone. But it's a conversation where a man needs to check himself out. Like, how does my breast look like? Do we even have those mirrors? To check for you to understand, when last did a man look down to look at the color of the breast? It is a conversation that we must have, but how do we ensure that men then become part of this conversation? Like, talk to me. I'm here.
You're there, man. You are this man.
Because you see, it is, I have to touch.
Yes.
But these are things that in a normal day, it's a conversation men never have.
Yes.
Yeah.
Yeah, and I think maybe to address this, we also need to look at the health-seeking behavior of us men. As men, we are socialized to be stoic. We are the man. I mean,
kwa chuma.
Yeah, lazima mwanaume ni kujikaza.
Struggle.
Yeah. So as a man, really we need to address the issues of our own personal health, not just breast health, but overall health, and also address the issues of health-seeking behavior. It's not about waiting until I have pain or something really nagging, or have my partner or my wife, my spouse, my partner, whoever that may be, nagging me. You need to go and get checked. And in the evening, you come back and say, ulienda hospitali, sikwenda, there's no pain, so I didn't have to go. So still as a man, if you notice anything unusual, take that step.
Okay. Go
get checked. It may not necessarily be cancer, but if it is and it is caught early, it is also treatable and curable. So we really need to think about our health and take a step towards addressing it proactively, so that it's not always about going to seek help when you can't bear the pain, when the people around you, the caregivers, and maybe we'll be talking about caregivers around you, are so distressed that they carry you yelling and screaming to hospital. We shouldn't wait for that.
Okay. I want to go back, Dr. We have very quickly linked cancer to lifestyle. The foods that we eat, processed foods, we are not eating traditionally as we would before, especially as Africans, and that's where it has seeped in. Are these myths or is this true? And as we do that, what then actually causes breast cancer, if we have a cause so far?
So thank you. And just to take us a little back, he was asking for men, there are no mirrors. Actually, there are mirrors. How do you shave?
It's just...
Now we are saying, when you shave, remove your vest. Yeah, take that opportunity. Yeah. Because with men, you have small breast tissue. And if there's a lump and you ignore it, can spread quickly. The symptoms are the same like for women. And it's doable. So know you are normal. Ask your spouse, your girlfriend, your wife also to touch. Breasts are beautiful both in women and men. So they touch, they check for lumps, for changes. Back to causes. I think it's a myth that our traditional food never caused cancer.
Okay.
Breast cancer is caused by many factors, multiple, and no single one you can pinpoint that this is the cause. Over 60%, no one knows. So we are shifting towards early screening and getting to know your normal breast, so that if there are any changes, you seek help. Having said that, we have risk factors that can cause breast cancer. Number one is having a breast. So you can't do anything about it. Secondly, is having a positive family history of breast cancer. Maybe your aunt, your mother, your sister, your grandma had breast cancer. Then it means it could be familial. You could be carrying some cancer-causing genes without knowing. Another one is aging. When people grow older, the chance of getting cancer is higher. First childbirth. We are going to school, getting educated, getting work. So people are busy. So they're not having children at an early age, below age of 30. And that one is a risk factor. Breastfeeding, busy mothers, you want to go to work. So if in the older days, our mothers used to breastfeed because they were housewives, they were not going to work. But now we are being told the less you breastfeed, the higher the chance of you getting breast cancer.
Why though? What's that thing that breastfeeding a baby, does it release something? Does it flush the breast? What does it do that if you didn't breastfeed, for example, because there are many processes that go on in the breast, from the brain to the breast when a child is born. So if you don't do that, is there a factor that plays in there that tells the body something else and then will start to grow these abnormal cells? What happens?
Yeah, it is linked to probably some hormonal changes coming into play. And it is thought that when you breastfeed, it's more protective than when you don't, just because of some hormonal imbalances. Also, having fewer children, actually, or having no children at all, increases the risk.
How much is few now? Because, people are starting to get worried here.
Few is... Okay, there's no cutoff, but few is around 4, less than 4.
4 is few children?
Mothers used to get how many kids? Like
10.
Me, I'm the firstborn in a family of 10. So you can imagine, they had big numbers. Apparently, it was protective.
Wow.
Yeah. Having said that, also the use of contraceptives, these that have a lot of estrogen, can also predispose one. If you get into menopause and you start using hormone replacement therapy, it can also expose you to that. Then they are talking of tobacco smoking, lack of exercise. All these things, they come into play, and no one you can pinpoint. But obviously, we always see if you have a breast, that one everyone knows. Yeah, and then if you are a woman, the risk is even higher than if you are a man.
So if it's hereditary, then there's a gene. Is there a gene that predisposes one to then carrying this? Of course, there was a famous story of Angelina Jolie, whose mother and grandmother had passed from this cancer. She went and did the test, found out that she carried this gene as well. So she went and got a double mastectomy.
Yeah, definitely. There is a gene.
Okay.
We call it BRCA, or breast cancer causing genes, which are passed down families.
Okay.
And once the tests are available, so if you notice, like, your grandma, then your aunt, your mother, your sister, then it's a wake-up call that probably these genes, bad genes, could be running in your family. And there are studies showing that you can go for prophylactic, which means you go for the breast being removed before even you get cancer. So you not have a breast and you not get breast cancer. And sometimes these genes also can cause ovarian cancer. So screening is very important also.
Okay. How do we carry out screening? Yeah. How do we carry out screening when also the cost factor, Dennis had mentioned, you don't feel any pain, you're not going anywhere. We think we are okay. When it comes to why should I go spend money for something that I don't feel anything about, how are we dealing with that, David?
Yes, I think it's important, and this is part of the important conversation we are having here at SpiceFM, that we don't go for screening when you're having the symptoms. You have a lump, you have a wound. That is no longer screening. You're actually going to have a diagnostic test to know what is going on. Screening means you are a healthy individual and you are going to have a check. You may not actually have any symptoms at all. You're just going to have checked so that in the event that there is something going on, say a disease that you have not even felt any symptoms about, it can be picked and addressed long before it starts causing symptoms. So it's important, as I was saying earlier, for us also to invest in our own health. And screening is available in the level 5 hospitals. In most government level 5 hospitals, screening for breast cancer is available, at least at level 5. But importantly, again, is the personal responsibility to regularly check yourselves and to go for mammogram as screening at a level 5. But even then, there's also a place for having a clinical breast examination when women, go to, for example, take their children for vaccination. They have a lot of encounters with health workers, and they can also have. Apart from having checked yourself, you can have a clinician do a clinical breast examination just to affirm what you have been feeling or not feeling. But important is to also have the gold standard is the mammographic screening that you don't have to wait for symptoms.
Yeah. So, Dr. Even as you talk about screening, which is important in addressing issues to do with the breast cancer, we go to the fact that there is cost involved. Many have argued your health is important, cost should not be a subject, but unfortunately it is always a conversation that is out there. So in terms of perhaps what government should do to make it affordable for individuals in terms of subsidizing medicine that is involved, subsidizing equipment that is being brought into the country to make it affordable for stakeholders in this space, to just make it affordable for the stakeholders who would then make it affordable for Kenyans who are coming in for screening and even treatment. What would be the standpoint where we are in terms of cost in treating and even screening cancer?
So screening is much cheaper. And if the cancer is diagnosed early, it's also cheaper to treat. The government is trying, now there is what is called the NESP program, where the vendors place equipment in hospitals. In the past, hospitals had to allocate budget. This is public hospitals had to allocate budget, and it was such a big strain. Now, the equipment will be brought by the vendor at no cost. They are installed, and there's a focus on mammograms. As we speak, Kenyatta Hospital has a new mammogram installed by that NESP program, and will soon be commissioned for screening, and it is covered by SHA. So that is one way of trying to reduce the burden to the Kenyans. In terms of treatment, with early diagnosis, we've said treatment is cheaper. You may get away with surgery alone, for example, and surgery is covered by SHA. We look at chemotherapy, radiotherapy, it's all covered by SHA. Like almost 70% of the cost is covered. It depends on where you go. If it's public hospitals, then it's almost 100% fully covered. We also need to be proactive in terms of registering, because our health is our responsibility. So we register, have an insurance. SHA is the most affordable. And if you can afford a secondary medical insurance, why not? So when you run out on SHA, you have a backup to help you. Make sure your family is insured with medical. You know, we always focus more on education of our children. We forget ourselves. Our health is important so that we are more healthier and stable. We are able to work and support these families. Thank you.
David, Dr. talks in terms of, you look at what the government is doing. So we have SHA, we have a payment that is involved, and all this is conversation that would go into, so you want to go get screening. Remember, you can go pay off the pocket, but then again, there are all these initiatives that the government has given unto you. But unfortunately, we still live in a country where, again, I will only go pay the annual payment because I am now sick. I am tired. You know, I am at a point where I really need this service. Goes to also speak in terms of our health-seeking behavior. Because if we had paid earlier, it would be easier for us to go to hospital, to go for these tests, go for these checks. So I just want you to speak in terms of, especially men, because here at Onanga Hospitali, men and health-seeking behavior, and also just Kenyans in terms of, fine, we are on SHA, we have registered, but we equally need to pay.
Yes. I think that's an important perspective, because when you're also paying for SHA, and must pay for, should pay for SHA, even with the challenges that we have had, every Kenyan is better off with a SHA than with no SHA. You know, especially because it covers some of the screening and covers, treatment in the event that you are sick. So first we need to move from a place of paying up our SHA premiums when we are sick, or paying for relatives and family members when they are sick. And that is what we see all the time. A patient will show up and you ask, have you paid up for SHA? No, sasa ndio tunaenda kulipa. We are paying because now it will help us. And that should change. We should just pay because it's the right thing to do. And when you have SHA, obviously, and because you have a cover for your screening, we need to take a step forward and go and get screened. So if you are told the screening is negative, there is nothing, at least well and good. Thank God you can wait for the next year. So one should not get tired because you say, oh, I did a screening 4 years ago and it was fine. We don't know what has happened over the past 4 years. We need to proactively do that. So a screening, whether you have SHA or not, and importantly, should have SHA, is something that is central to effective cancer control, to catching disease early and treating it early. And it is really indeed our responsibility as citizens. The government can do so much. For example, the government will place all those equipments, have the machines, but we as citizens also must create demand, by, going. You'd rather go Nambua Q Mrefu. We are creating demand and demand for more machines, kule mashinani. Yeah, so if they praise the machine and nobody is going to use them, that will not reduce our cancer rates. Technology can only do so much. You may have all the top-notch technologies down to the smallest hamlet, down to the smallest village, but unless we as a people go forward to now say, yes, we need these services, we demand of these services. And that is also the way we also hold even our politicians accountable, say, we need these services and they are not available. We are demanding that we should have mammogram machines if they are not in your sub-county, if they are not in your sub-location. You need to demand for that. Yeah.
Okay.
Yeah.
For screening, it's clear that there are efforts that are being made to ensure that screening happens around the country, to at least make sure you know where you are. We've heard oncologist after oncologist tell us, Dr. Nyongesa, you said the same thing this morning as well, that if you catch it early, you can treat it. Are we looking at full treatment, full recovery from cancer, stage 1, stage 2, if you find it early? And then even as we do that, I'm sorry to add another part to this, but what exactly happens during treatment? We hear radiation, we hear chemotherapy. What exactly is happening in the body while these two treatments take place?
Okay, so in terms of early diagnosis, it is true. Cure rates for stage 1 to it's over 90%.
Okay.
Yeah, and then stage 3 and 4, it goes lower. Though there's hope. As I told you, the breast cancer tumors are different. And there are some which are more aggressive, others are not. And still with stage 4, patients get healed, so long as they follow the right treatment. How do we encourage people to go early for screening? I can tell you, maybe, for example, we are going in political mood. I tell you today, a popular politician is coming to my village. You'll see how many people will come out, isn't it?
Oh, yes.
Yeah, but we tell you, Makumi is coming. How many people will come out for screening and awareness? Very few. So we need to be proactive. The same energy we use to go to political rallies, let's go for screening. Let's go for health check. To in case of any diseases, we are treated in early, and this can lead to higher cure. For treatment, we have various types. It also depends on the stage. It depends on the receptor status and those small red flags we talked about. For stage 1 and 2, operation. And it can be the only treatment one needs. Depending on what the doctor finds in the lab, then they can recommend chemotherapy or radiotherapy. And what type of surgery are they doing? Are they removing the whole breast, or you are doing a breast conserving treatment? For slightly advanced disease like stage 3, then the doctor will give you chemotherapy to shrink the tumor, and then surgery can follow. And also from there you will need now those additional therapies like radiotherapy after the surgery. Some patients may need hormonal therapy for 5 to 10 years after the treatment. You will need, some need what we call targeted therapy, like HER2 targeted therapy, which you'll have to take for 1 year. Others may need immunotherapy. So there are a lot of things that are coming out. And what is also trending now is that radiation treatment can be moved from 3 weeks to a week.
Okay.
Yeah, studies have been shown in the UK and also here in Kenya at Kenyatta Hospital. We call it Wiki Moja study, that women with breast cancer can shorten their treatment duration to just 5 days from the 15 initial days, and it is safe, effective, and patients finish their treatment quickly and are able to get back to business and go to work.
So what's happening in this 1 week? Every breast cancer has a tumor.
Yes.
Okay. So during this treatment, are we shrinking the size of the tumor, or has surgery already been done, or are you shrinking it so that surgery can be done? This Wiki Moja, what exactly is happening here?
This is for early breast cancer.
Okay.
So surgery has been done.
Okay.
And depending on the type, the subtype, chemotherapy has been done. And then you are told go for radiotherapy. So the radiotherapy is the one that can be administered in 1 week instead of 3 weeks. Okay. So the dose is higher. You finish the treatment quickly and you go back to your work. Because as Makumi said, we are seeing young people with breast cancer and you can't afford to have offs. You went off for surgery, a lot of off for chemotherapy, now a lot of off for radiotherapy. So we are looking at how can this treatment be shortened using evidence-based, and it is effective. So the short treatment is really, there's no tumor in the breast. It has been removed. So you're just going for radiotherapy, which is going to prevent the tumor from coming back. And this can be administered in 1 week. That is 5 working days.
Okay. David, I remember Mary Onyango, who was a champion for breast cancer awareness, and she was also living with breast cancer before, unfortunately, complications of the same, she passed. But I remember that one of the things that she tried to do was to let people know how you would feel during the treatment. And so that kind of prepared people psychologically that if you're going to go and get treatment, this is how you will feel. So there's the hair loss, there's the sick feeling all the time. How do folks cope with that? Because a lot of people say, well, you know what, if I'm at this stage, I don't want more uncomfortability. How do you deal with that?
Yeah, thank you. I had actually the benefit of doing some of those awareness activities with the late Mary Onyango, at personal level. And many other heroes who've gone before us. But really brought the breast cancer agenda on the table, played their part. In addition to what Daktari has said, the components of treatment, chemosurgery, radiotherapy, all those things are important. But also importantly is the psychological and emotional preparation of the patient. And this is where information comes in. The mental framework of how the patient is right from diagnosis. Certainly cancer, some people say the C word is a big thing. The distress associated with the diagnosis is immense, not only to the patient, but also to the family. They've heard all those things about, hair loss, about fatigue, about, side effects of therapy. So all those things, there are a million things that will probably go through the mind of the patient upon diagnosis. And in our setting, we've said these are young patients. They have a young family, they have a couple of young kids, perhaps less than 10 years old. They have a career in front of them. They probably have just married. There are all sorts of things that would go, and they can be really devastating. And, they have family dynamics to deal with. When they think about perhaps I'll have a breast removed, what will happen to my spouse? How will my immediate family view me, the larger community? And that is, there are these issues around stigma. How will I cope without a breast? You know, how will I cope with the hair losses? How will I cope with maybe I've just started some work? Maybe, and most of them are ordinary folk who perhaps sell mandazi or manjugu karanga, or they are roasting maize. You know, all those little things, their nuances are so important to the patient. So when the doctor is explaining to them, you know, maybe you'll have surgery. And if the breast is actually, the disease is so early, as Dr. was saying, you know, you can actually save the breast. The breast may be, the disease may be removed, but it had better be caught so early to conserve that breast. But, you know, in our setting, we still see many patients who will require mastectomy. The breast have to be removed. So psychologically and emotionally, how do you prepare that patient? And that is part of the work we do at Faraja, bringing patients who have survived cancer. And we have, this country, we have patients who have survived cancer for 20, 25 years. You know, I know women who've been around for so long, you know, the breast cancer is behind them. And we use them to encourage and prepare the others to say, yeah, it's a journey I walked 15, 20 years ago, and this is how I coped. But information is important. One, of course, how the diagnosis is broken to the patient, and getting them time to internalize that, and also preparing them in terms of what to expect from the treatment. If they're starting with chemotherapy or with surgery, what do I expect after that? What will follow what? So it's a journey. It's really not a sprint. It is it's a marathon. And what we reassure patients and their families, that it's one that you never walk alone. You need a support system. People, either immediate family. In fact, one patient used to tell me, David, you need to tell your patients to choose their team well. Upon diagnosis, choose your team. Who is going to be in my inner circle? Who do I tell about my disease? And who do I not? You don't want people, folks who will just bring negative vibes and start thinking about, you know, poor outcomes. You need people who will bring positivity, who will stand with you and encourage. So you choose your team well as a patient, and also access to accurate information, so that you know what to plan for, what to expect. Another component that is even very often missed is even financial planning. Do I have SHA? Because some patients, you start treatment thinking like, you know, it's a quick fix. I just go in for surgery, and, you know, after a couple of days, it is the treatment is long. It is complex. And so preparing for that emotionally is so important, because then doctor will tell you, some patients will be told the diagnosis and they vanish. You know, almost lost to follow up. You say, this person came, and then after they are told, they didn't come back. Probably they went to some preacher, they went to address those things traditionally. Those are all myths, because those are the patients who come back again with advanced disease. And you ask them, where did you disappear to? They went for prayers.
You actually brought in something very important, because even our listeners are asking Daktari in terms of alternative medicine. So one has come up, phytotherapy as one of the ways. So just address that, if that is an alternative or an option for cancer patients.
You saying?
Phytotherapy.
Phyto?
Yeah, phytotherapy.
Okay.
Yeah.
Yes, so now the treatment of cancer, and breast cancer to be specific, we follow the international guidelines. These are the American guidelines, European, and also in Kenya we have the National Cancer Treatment Protocols. This is standard, evidence-based. So let patients not be lied to. They go to alternative treatment without first seeking a professional to explain to them what the treatment entails. In fact, I encourage, as you are choosing your team to support you, get a medic in the family that can work with you, somebody you trust. Go to hospital and ask all those questions, because the treatment is clear. It is multidisciplinary. So we have various disciplines involved. We have the surgeon, we have the radiologist who looks at the scans, know the stage, the pathologist who will analyze this sample in the lab. We have the navigators who will navigate all those barriers, financial, psychological, physical. Many patients, they don't even know where to go to seek for help. We have the oncologists We have the radiotherapy. Like it is, I can't name everyone, but it's a whole team, even nutritionists that come together. So once you have these people with you, they'll give you the right direction. Some patients are told, you go for prayers, this thing will come out. Others take these concoctions, the tumor will come out. For breast cancer, when you start noticing it bursting through the skin, coming out, it is a sign of advanced disease. So when it's still inside the breast, it has not burst, it is the best time to catch it and treat it with very high cure rate, less money that you will spend.
There's also a question on, say, a cancer patient has gone through treatment, but then again, cancer may come back. And when that does come back, it comes back more aggressive. What usually is the reasoning, or what is the cause of why it comes back more strong and even mutates?
When you have cancer after treatment, unfortunately, there are chances it can come back. The chance is lower with early diagnosis and higher with late diagnosis. Though there are still some who had early cancer, but for strange reasons, the cancer still came back after months, years, and no one really knows. It is important after treatment, continue with checkup. Join support groups, cancer support group, like Uwezo Cancer Support Group, where you engage with other survivors. What are they doing? Your health is important. You may need to have your heart checked. Sometimes patients get heart complications because of the treatment. You may need to more screening, by the way. Even after breast cancer, you are supposed to go for a mammogram. You still have an intact breast which can get cancer. So you go for screening. You have a mammogram. You have clinical breast examination by the doctor. They want to check where the lump was removed. How is the skin? Is there any new masses forming? How is the good breast? Is there a problem? Also, in terms of cosmetic, you can actually go for breast reconstruction just after the lump is removed or the breast is removed, or much later. We call it delayed reconstruction, so that you feel beautiful again and go back to your normal life, go back to work. And stigma is real. So with these support groups, they encourage you. They say, we've been there, we've done that, and there is hope. You can live. There's life after breast cancer. So patients should actually follow their clinics well.
David, have you come across folks who want to mix conventional medicine with traditional medicine?
Yes.
And does it work?
No. we only can speak authoritatively about conventional medicine, because that is tried, proven, over and over. How you treat breast cancer in Nairobi here, using evidence-based approaches, is how they'll be treating breast cancer in Brussels or in Texas or in Australia. Tried and proven over and over. So many patients in our setting will go and try other things. Half the time there are those who will try other things and still come to conventional medicine, but they then don't disclose that to the doctors. They won't come to and say, I'm also using something else or trying something else. And it is important that patients tell their doctors, and also important for the healthcare system to create an atmosphere where a patient can disclose all these things, because the doctor would want to know, what is this you are taking? It may be things that would have adverse interaction with the medical treatment that you are having. And when you start experiencing maybe strange side effects which cannot be explained, and it may be because you are taking other things, and it is important that this disclosure happens. So it's important that patients really follow their doctor's instructions as far as treatment is concerned. There are other what we say complementary therapies that would enable patients cope with the distress of a cancer diagnosis. Psychotherapy, meaning you have an opportunity to sit and talk to somebody, pour it out to somebody. You also may engage in activities like, for example, Zumba, just to be able to cope, because physical activity, even during treatment, is important. You may be able to get involved in activities that help you relax, mind-body exercise. It could be yoga. It could be listening to music. It could be art therapy. Some of those programs are actually available. There are programs that we also run at Faraja that patients may just come and paint away, and that way, mentally, they are able to cope with their treatment. Okay. But in terms of taking, there could be herbal concoctions or whatever concoctions. Indeed, many patients come back with advanced disease because they went to try something else. So we also do not underestimate the role of prayer and spirituality in coping with life-threatening conditions. So, but they are not in themselves, they're important. They only help you cope with your chemo, with your radio, but you won't stop treatment because you went to some place, somewhere in some bush, to be prayed for. You shouldn't.
I hear you. It's been Breast Cancer Awareness Month, the whole of October. We're having this conversation today to remind ourselves of many things. And of course, our hearts and minds are with those who are walking a cancer journey today, to be able to afford the care that they need, but also to then cope with the situation as it is. We thank you both for the work that you do, and thank you for then being able to come and have this conversation with us to also remind us. And that was very interesting that, where we can all gather around for a rally, we can gather around for screening.
Sure.
We can. And also for the support that you give to folks who come in socially, mentally, physically, and spiritually. Thank you both. Dr. Catherine Nyongesa is an oncologist. David Makumi is the CEO of Faraja Cancer Support Care Trust, and have both been here this morning. Thank you very much.
This is the Situation Room, the only way to start your day.